In today's show, we will be exploring a chronic issue that has often taken an average of 10 to 20 years to receive a diagnosis, causing many people to only receive an accurate diagnosis well after their 40s. We're talking about EDS, also known as Ehlers Danlos Syndrome, a connective tissue disorder that affects primarily your skin, joints, and blood vessel walls. And of course, we're going to dive into the question of the week. At what age did you get diagnosed with EDS or hypermobility? Are you ready for another chronic pain conversations? Let's go. Hello, my name is Kalila Bruswell, and this is my lovely co-host, Sharifa McLaren. We want to welcome you to Chronic Pain Conversations today. This is a show where we have open, honest dialogue about chronic pain. We share our experiences, acknowledge the wide variety of chronic pain diagnosis, and look at ways to manage chronic pain. So let's get into a little pain and pleasure today because I want to know how both of our bodies are feeling before we really get into it. Sharifa, please tell me, pain or pleasure?
Okay, so I have been pretty good the past few weeks. Everyone's heard me say pleasure, pleasure, pleasure. Today, I am absolute pain.
Oh,
Over the weekend, I want to say sorry, before the weekend, I was having a pain in my lower back going into the side of my leg, like my hip into my thighs. And it just hasn't even been making me sleep. So as we speak, I got a pillow behind me supporting my back. Because right now I am smiling, I seem okay, but I am dying and I'm lack of sleep. So all pain right now. Kalila, how about you?
Well, I'm with you. You guys haven't known it, but it's been here from day one. It's what you need to give us comfort to sit or to move for the last 30 minutes.
Mm-hmm.
So I'm still pain and pleasure. Which one do you want to hear first?
Let's hear pain because pleasure always lightens up the mood. So let's go pain first.
Pain is the fact that I had to get nerve block injections for the first time, Sharifa, in my elbows, in the front and in the back of both my elbows last week, because when I'm trying the cold while I'm trying to open my arms out, they hurt to the point where I couldn't pick up my mouse. I couldn't write.
Can you quickly explain what nerve blocking is for those who don't know? Just real quick.
So nerve block injection is, so you know when you go to the dentist and you get the cortisone, and it numbs you? It's kind of like that. One day I will show you the length of the picture. One day I will show you a picture of the different lengths that they put all over my body. I'm used to it in my neck and my back, but since this new accident, my elbows and my arms have been affected. And so it's been really difficult for those that have been watching and understand. We've been in minus weather for the last week. So me and Sharifa, we're laughing. We're laughing because we don't want to cry on the show right now. It's really
Trust me, I'm trying to hold it together. But after this, I'm going to crawl into bed.
Pleasure. I did a She Exists conference yesterday online. Amazing. We had Cheryl Cobbs on as our speaker. We had some really amazing and influential women, and we were talking about pivoting, not just in this dynamic, but just, in the new year. So yours truly had an opportunity to be an inspirational speaker, and that's my pleasure. But let's go into something that's really interesting, okay? Because I don't know if people know this or not, but today is unfortunately, Groundhog.
Unfortunately, because I was watching the news. I was up keeping tabs on this groundhog because I'm like, you best come out. You better.
So do you know how to say his name?
I'm not even gonna try. Still, I'm not gonna do that to him.
Was it Punxsutawney? It's the name of Punxsutawney. Yeah, we're gonna
like that.
Punxsutawney Phil. He saw his shadow and predicts 6 more weeks of winter. So first of all, Sharifa, do you believe in this groundhog prediction?
Honestly, when I was younger, I kind of do. But at this point, it's just like when it goes away because we don't have no control over when it even gets here. Like at this point, I mean, I'm kind of hopeful that when he predicts an early spring that it actually comes true. But at this point, it's like it's all fine and dandy for who believes in it. But I'm just excited for when the day comes when the warmer weather just starts to come. So how about you?
Okay. So basically for me, it's really funny because I was trying to take a look at it, and the official day of spring is on March 20th. I'm like, isn't that 6 weeks anyways? So like maybe the brownie just knows when it's away anyways. So we'll see what happens. But I am praying for all our chronic pain sufferers out there. Whether we have 6 more weeks or not, please take care of your body. Advocate. Tell your world. I'm sorry. Okay. Are you ready to get in today's conversation, Ms. Sharifa?
I am ready. It's going to be an interesting one.
Yeah, let's go.
So, did you know that based on 2015 population estimates, it's estimated that 2,762 individuals in Ontario are affected by EDS?
That's a lot, Mama.
That's a lot.
That's a huge lot.
As mentioned previously, classic hypermobility and vascular types account for almost 80% of the EDS population.
Oh my gosh. Serious? 80%. So it's the classic ones and the hypermobility ones and the vascular, which we're talking about the blood cells, right? Mm-hmm. Are 80% of it. So this is very interesting. Okay. So tell us what we're going to do, my love.
So right now we're going to watch a video. It's brought to us from a YouTube channel called Expert Doc, and it's XPERTDOX. So it's not what you think it is. It's a whole different thing. They're going to explain properly in depth what EDS is. We are familiar, but we want to come with very valid sources and information to you. So this will give us a little introduction as to what we're really going to dive into and hopefully help you to understand what we're bringing to you today.
All right, you guys ready? Let's roll.
Ehlers Danlos Syndrome, or EDS, is a connective tissue disease that affects about 1 in 5,000 people. It is the most common group of disorders in the family of hereditable disorders of connective tissues. Multiple symptoms are present in EDS since it is a disease of connective tissue which is found in virtually every organ system. Excessive joint mobility is the hallmark of the disease. The name of the syndrome comes from the names of a Danish dermatologist, Edward Ehlers, and a French dermatologist, Henri Danlos, who described it in first decade of 20th century. Ehlers Danlos syndrome is caused due to a mutation in one of more than a dozen different genes. The affected gene determines a specific type of the syndrome. Some forms of Ehlers Danlos syndrome relate to problems with collagen production and composition, though the particular issue varies. Body's many connective tissues, including cartilage, tendons, fat, and bones, may falter and fail when collagen and its enzymes are disrupted. The pathological changes mainly involve joints, skin, and the walls of the blood vessels. In total, there are 13 different types of Ehlers Danlos syndrome, the most common of which are classical EDS and hypermobility EDS. For all the types of the syndrome, changes in the skin and joints are almost same in nature, differing only in their severities. Vascular EDS is most serious type due to high risk of life-threatening complications. However, Ehlers Danlos syndrome is more than just the issue of hypermobility. Unfortunately, the possibility of EDS is generally acknowledged in a patient only after joint hypermobility is recognized. Only a handful of clinicians have the awareness or understanding of the multisystem nature of EDS. Often, multiple physicians become involved in the care process, each managing only the separate issue for which they are consulted, thus leaving many dots disconnected. EDS can produce problems of the immune system, a range of gut disorders, chronic pain and fatigue, problems of the heart and blood vessels, obstetric issues, and chronic headache. The syndrome makes the person lose the balance while performing simple activities such as walking down an even paved path or gripping a moving ball. All forms of the syndrome lead to instability in the joints, which can bend past the typical ranges of motion. While the looser tissue allows greater flexibility, it also adds to the clumsiness, making people vulnerable to dislocating or spraining joints. Widespread and bone-deep aching pain is a core concern for almost every patient. In some forms, abnormal collagen causes cigarette paper scarring because the skin may appear extremely thin and wrinkled like tissue paper. There can be issues of abnormal bruising and bleeding, tissue fragility, hollow organ rupture, and frequent joint dislocations. The condition is mild in some people, causing only slight clumsiness and looseness of joints, while in others, blood vessels of vital organs can tear, leading to torrential internal bleeding, which can be fatal. Diagnosis is based on the characteristic signs and symptoms, and quite often, a detailed family history. Extremely hypermobile joints, stretchy skin, radiographic and histological findings, and a family history of Ehlers Danlos Syndrome are often sufficient to frame a diagnosis. Genetic tests can confirm the diagnosis in 12 more rare forms of EDS, but there is not such test for hypermobility EDS.
Okay, so that should have given us a more general understanding of what EDS is. So there are many different types of EDS. There's approximately 13, like Clea. That's a lot.
It is.
So we have cardiac valvular EDS, okay? Then we have classic EDS, which is skin hypertensibility, where the skin texture and there's absence of atrophic scarring. So your skin is like easily stretched, like beyond what should be the normal range of stretching, which is quite scary and unusual. Then you have, with classic EDS, you have generalized joint hypermobility. So things that people like putting their thumb to touch their wrist, all of those things that you believe that people shouldn't be able to do, you can do it. Like putting your hands behind your back and bringing it over your head, all that stuff. And then you're easily bruised skin, or you have discoloration of the skin from like the bleeding underneath, which is the bruising. You have vascular EDS, which most people get an arterial rupture at a young age. So your arterial vein will rupture. More common in women, your uterine ruptures during the 3rd trimester in the absence of a previous C-section, or perineum tears happens as well. So then we go into periodontal EDS. So that is by itself atrophic scarring and just your skin stretching, hyperextensibility. That's all that's affected alone. That's where you just stop at it being periodontal EDS.
Okay. So I guess I'm getting into that hypermobility part. Am I not?
Mm-hmm.
Okay, so this was actually really interesting for me that we're talking about this, because I'll get into my story a little bit later, but this might be something that's actually affecting me. So EDS, so the hypermobility version is a generalized joint hypermobility. Like your boy can go further back. You know, when people do things like that, how far back can you reach your, right? I can go back. So they basically what happens is you have 2 or more of the following features in addition to the joint hypermobility. So one of those features could be a systematic manifestation of more generalized connective tissue disorder. So basically you're not just having your hypermobility, but you're having more of the tissue disorder. Another option might be you might have a positive family history. If this is coming from something that's coming from your lineage, it's hereditary. And the third option is if you're having musculoskeletal complaints. And so if you have 2 out of those 3 with your joint hypermobility, all of these need to be, these prerequisites need to be met. This is an absence of the unusual skin fragility that we were talking about, the exclusion of other hereditary connective issues. All of these things means that you might have, may include hypermobility, but it means that you may also have something else. There's another word. Now, here's my thing. I saw that you were struggling earlier. I was struggling earlier. And we keep telling our audience, please bear with us.
We're not doctors.
It's not that it's not just that we're not doctors. We're still trying to learn some of these words because this is a whole new world.
Big words.
These are big scientific words. Yeah. And I'm pretty sure some of our audience is trying to figure out, how do you say that anyways? If we might have to one day put up the word so that you could be like, oh, okay, that's how you say
it. Give them a bly.
Arthrochalaceae. It's a congenital bilateral hip dislocation. So we're talking about your hip now, your hip being loose. So several of these, which is part of your this, including, sorry, I lost myself for a minute. This with a multiple dislocation, and you have skin hypersensitivity. So the same way that we're talking about your skin pulling in your hip area, and this is affecting the area of your hip joint. Myopathic EDS is a muscular hypotona and a muscle atrophy that improves with age. So basically, your joint contours, so your knees, your hips, your elbows, your hypermobility, and your distal joints. This is where myopathic EDS comes in. And there's so many words. So can we take a minute for it? Because we're trying to say stuff and people are like, this is where, we're trying to say stuff. And we've got audience members that video was talking about there being specific 1, 2, or 3 particular main
forms of
EDS, but we're looking at 13 of them. And 13 of them, some of them we can't even pronounce, and we're trying to figure out how to understand it. So now how do you, as an audience member, a patient, you're trying to learn about this yourself. And some of these words are so big, or just trying to describe them is so hard that you can get lost in this, which is why it's really important when you're doing some of your research, when you're talking with your doctor, and some of the tricks that we're using is learning how to pronounce it. Because we're seeing things like your cornea and your X, Y, and Z, and it's like, whoa, it's affecting, again, what we got to remember is our body are connected in so many different ways that one chronic pain issue can be a root effect of something else or be connected to something else.
Yeah.
So this is where I really want to advocate about when you get lost in the medical world, when you get lost in its wording, take the time to break it down, become resourceful. And if you don't understand a specific aspect of it, talk with your doctors. Great. For me, some of my main resource places are WebMD, some say Mayo, some say Mayo Clinic. So make sure that you're going into that. But one of the things that was the biggest shocker for me is one of the things that they kept saying was hereditary.
Yeah.
Like, Sharifa, the fact that this can be hereditary, the fact that, you can get it paced down, the fact that, I'm going to tell you a joke in a moment. The fact that, we don't think about this stuff. Some people live their lives. They don't like going to the doctors. They don't know what their medical history is. They don't pass it on to their kids. And it's really funny because this is really important. The fact that some of these diseases are transferred hereditary, or it might even skip a generation. So off topic, but on topic, I have alpha thalassemia, which is an iron deficiency similar to what you would think is sickle cell anemia, but it's hereditary, right? It's not until I was in my 40s, because of my first car accident and because of the way that my iron dropped and some of my medical things dropped, that they were like, we always thought I had sickle cell anemia, but it always came back no. But they were like, something's wrong. And one doctor, after my most accident, she's like, let me check something out. And then I found out that I had alpha thalassemia. And it's not from one parent, it's from both.
Wow.
Which made it me worse.
Yeah.
Right?
Yeah.
So what happens when, you've got one person and you're living with hypermobility, you're living with EDS, and all of a sudden, what does it change like? Are you informing your kids? It's not that you can stop it, but you can also, if you know that this is something that you should get diagnosed with or leave for your family to understand. We're talking about, might not be just your children, it could be your grandchildren. This should be something that they should, for me, I think that this should be something that we talk about.
Oh yeah, for sure.
Am I making sense?
No, 100%.
Have you ever had that, like, are any of your symptoms, because, something from your family, they blessed you?
Well,
with those genes? So
I have sickle cell trait, and I know that's from my mom. As for me having lupus, here another big one, lupus nephritis erythematosus. I got a big one too.
You're just being fancy now. How long did it take you to learn that?
Honestly, probably about 3 weeks.
Okay, so I don't feel bad now that we're coming.
No, don't feel bad whatsoever.
But we do promise, audience, we'll get better at saying them.
Having lupus, they did say it should have been hereditary as well. We did do testing down to my grandparents, no trace of it. So that's another one where they're wondering, like, where did it come from? But there's certain things they say should be hereditary, but who knows? Maybe, like you said, God just made me the one that he blessed me with it.
All right. So let's talk a little bit about symptoms, can we? Because I'm actually on my journey right now to find out whether or not I have hypermobility. Okay. So let's talk about symptoms, because, some people think that they're flexible. Okay. Overly flexible, and it's not the case.
There are two main symptoms that they say to, I guess, keep an eye out for it if you feel like it's way over the top, which would be stretchy skin or fragile skin. So I want to say fragile skin ties into easily bruising. You get, random bruise. I'm not saying you hit yourself and then the bruise comes up, because you would have known that you hit something, but just out of the blue bruising. Or if you can stretch your skin from here to Timbuktu and you're like, something's wrong with that. And also overly flexible joints. So we're talking about, those people put their hand behind their back and then bring their hand up over their...
West Indians call them bruck up.
I mean, yeah. If you feel like you're too bruck up, then that should be also a main symptom to take a look at too. If you can, like Kalila said, stretch your thumb all the way or stretch your hand all the way, or your elbow extends, but extends more than it should be. That's a symptom to maybe get checked out, and maybe that's a diagnosis. Maybe you do have EDS and you didn't know.
Okay.
Yeah, I want to hear what you've been going through, because we got to get you tested now.
Okay, so here's the deal for me and my body. Growing up, I was always the flexible kid. But now that I'm getting to understand this a little bit, this makes sense why my mother had to take me to Sick Kids Hospital like every other month, because I thought it was just me being a tomboy. I thought it was me just, breaking my bones and just being in a cast. I have had a cast on at least both arms and both legs, minimum of 2 to 3 times, right? So I just grew up thinking, you know what? I was flexible. And if you remember, when my first accident happened in 2017, one of the things that I fought for, and one of the things that really just pissed me off was the fact that I felt like I was so stiff. And I was like, I'm flexible. I am fighting for my flexibility back. I will be able to touch the floor again. And even when I was doing, because I've been doing treatments, clinical treatments. I had a slip and fall over a decade ago, and I've been doing clinical treatment since then. But I would get like really weird comments like, you're really flexible, Cleo. Like, you can fit yourself into spots or do things that, normal. And I was like, yeah, I'm flexible. I used to boast about it. Yeah, I'm flexible.
You were like, okay.
I'm flexible. Right? On the naughty side of things.
Oh my God.
Come on, girl. This is real. We're being open and honest. Let's not play like a gentleman. If he heard that there was a flexible girl, like a cheerleader, he wouldn't be like,
you'd be like,
Right. So anyhow, fast forward. Last year comes up and you guys see me in California because I went down for my mentorship and I stayed down for my health because it was so cold. When I made the decision that I was actually going to get treatment, that I was going to stay down there a little longer and I was going to get treatment, I got some referrals. So one of the clinicians that I saw, wonderful lady. And if you are in the California Orange County, I normally wouldn't say it, but go see Deborah. It looks like Chase, but it's Chassis, Chasse. And I remember being in the office, and because she was referred by my chiropractor up here, she was like, we have to do assessment first and then we'll treat you. And in my head, I was like, check. Can you just give me my treatment? I've been down here for a month. I'm in pain. What do you mean you need to assess me? And, my chiropractor was telling me it's part of the procedure. Anytime they take on a new client, they have to do that. But she did an assessment on me. And she was like, she told me two things. One, you have a very strong possibility of having lymphedema, which she couldn't diagnose because of her accreditation as a psychiatrist. Mm-hmm. And the other thing that she was like, and you're hypermobile. So with me, I'm that person when I'm walking, my knee will crack back. So I'll be walking and then it'll just crack, like it'll go back, joint back, and then I'll skipple in my step. Or I can crouch my body like really, really small. Like when you're stretching down and people put themselves into a ball, even though I'm a thicker girl, like when I say like, you put your feet over and then you kind of girl down for that stretch,
right?
The whole body will go down, right? Like when I'm stretching out, I can like pull my body a little bit more. So it's just always this, I just was like, I'm flexible. And she's like, no, you may actually be hypermobile. Mm-hmm. And what's interesting is in me being hypermobile, it makes me more sensitive because we're talking about the connective tissue. We're talking about the fact that it's not the same. It's not normal what people are used to. It means that there's oversensitivity in those areas in your joints. They're more exposed and being prone to different traumatic experiences. So when I now have gone through a traumatic life, a slip and fall, and 2 car accidents, my body went, So some of the things that I'm learning definitely with my fibromyalgia is that fibromyalgia is just the umbrella of them telling you that something is wrong. Mm-hmm. They don't actually know what chronic pain you have. So I'm very interested in going down this journey. And I'll keep our audience updated with regards to both the lymphedema and with regards to the hypermobility, because if I'm diagnosed with one of these, it's not necessarily remove the diagnosis of fibromyalgia, but definitely give more clarity into how to treat certain things with my body. Because that's why fibromyalgia doesn't work for everybody, because it's different. And if you have one symptom and I have a different one, we have to treat it differently. Does that make sense?
Makes a lot of sense. So yes, please do keep us posted.
Any questions about that? You've seen me, you're like, you can touch the ground. And I'm like, yeah, why can't you?
Yeah, but I never, like you said, it's not until us doing our research about this topic that we were putting the puzzle pieces together. And I was like, what if you got this? Or what if you got that? So. Yeah.
Okay. So, can you do me a favor?
Yeah.
Can we go a little bit into lifestyle changes and remedies before we talk about treatment and medication?
Oh, sure.
Cool.
Okay. So lifestyle changes and remedies. For me, I don't want to say having EDS is such a bad thing. It can be if you're used to doing like vigorous sports or vigorous workouts. But then the alternatives that they give you, they're still great. Think about this. So instead of like maybe weight training or like excessive running or all that stuff, try swimming. Who wouldn't want to enjoy swimming in the water? There's also Pilates. There's also yoga. I know Khalila's about the yoga.
And about the water therapy. We'll get into that one next.
Yeah, that was like my top one. I love the water, so I'm all for it.
Now, here's the thing. Can I stick in for a minute?
Yeah, no, go ahead.
So one of the biggest things that people don't understand is there's actually something called aqua therapy, not just aqua classes. And aqua therapy is with like a what's the word I'm looking for? Chiropractor, or physiotherapist. So they're actually doing that therapy in the water. So we're not just talking about just working out, but there's the option to actually have a clinician in the water.
Right. Because I think with that, there's a lot of resistance. So your body does get that exercise and
tiredness.
Yeah. But the best sleep is after a good swim, I have to say. And then they also say that gentle workouts are nice. So again, not anything too vigorous, just something that's gentle. They say, like I was saying earlier, to avoid contact sports like football, basketball, all those stuff, weightlifting, because it may put too much strain on your joints. And it also gives you more risk of injury. So with that, you should be wearing protective gear, braces for your joints, like for your knees, your elbows, and stuff like that when you're doing certain activities. And my number one thing is getting enough rest and establishing a good sleep pattern to avoid fatigue. Absolute number one, I think.
Yeah, you think that it works. Doesn't always work when you're in pain.
Doesn't always work, but it's a good thing to try to practice because our body does need that time to repair itself.
Okay, so I know one of the things is that we talk about treatments, and one of the things that they come into is always medicine. We always talk about medicine. So let's touch there before we go into some other stuff. So the ones that they always like, and I love this because where we researched it, came up with aggressive humanitarian pain release, aka high dosage of opioid therapy.
That's interesting. But
I like how they worded it.
That's very interesting. They try to make it look pretty, but continue.
But what kills me is the word humanitarian. Like,
yeah, that's why they try to make it look pretty.
I was like, what's happening with that? Okay, so basically what they're doing is, I'm not going to lie. Opioids can help. They've helped me at different occasions.
They've helped me too.
Fear is when people get addicted to the opioids because this is the only method in which they're like, shove it down, numb the pain. So they give you the high opioids because it is we're talking about connective tissue, and we're talking about that it leaves you with the inability to function. It leaves you with the inability to hold up certain things or to do certain things when your body is truly in pain. The very essence of what holds you together, connective tissue, is an issue. The other thing is drugs for uncontrolled muscle contraction. So some drugs are a combination which might reduce the muscle contractions, pain, and tiredness. If you're not on opioids, my strongest suggestion would be to try and stay off of them, but find yourself different treatments to get them. Use your drug control, because for me, like I have everything from Advil, Motrin, Tramadol, and I use them accordingly. And I don't go straight up to my opioids first, simply because I don't like the way that it leaves me and the after effects and the stuff that it does to your stomach. So that's one of the things that we want to talk about. Let's talk about physiotherapy. It is the best evidence that is out there. Exercise-based treatments improve your time. Stretching exercises should be gentle to avoid joint injury. So like you were saying, that swimming, that getting in the water, that Pilates, that yoga, those gentle workouts, Here's the thing. One of the things that I have heard the most in our chronic pain community is that it just hurts to move. Well, let me use this for an example. How many times do you have an elastic band? You leave it down there, you have your hair tied, you leave it down there, and about 3 months later, 5 months later, you find it in the corner of something and you're rushing to use it. You go to open it, and what does it do?
It doesn't snap back.
It snaps, or it doesn't snap back.
Mm-hmm.
Why? Because it hasn't been used. The elasticity in the very fabric of it that you can't see is withering away. But if you take up that same elastic and you start doing this with it for a minute, all of a sudden it gets longer. It gets more elasticity. It gets warmed up. It comes back. And all of a sudden I can stretch it more, right? It's the same thing with our bodies. If you start slow, we're not asking you to get up and to work out for half an hour. Maybe it's just 5 minutes for the day. That's what I had to start with, 5 to 20 minutes, depending on what the activity was, just to get the body warmed up. Sharifa, are you doing that? I'm going to be on you because I've been on you for a while.
I was thinking in my head, that's exactly what Kalila was saying to me. Was it yesterday?
Yes.
Yesterday, she was giving me some exercises, and the first thing she asked me, "Are you moving?" So it's definitely right. I have been moving. I'm still going to do things to myself. I might be slower than usual, but I'm still, as much as it hurts, moving around, bending. I've been doing elliptical, like you said, a lot of different exercises. So,
and what you'll find out is that the pain that you have this week will not be the same next week unless something traumatic is happening to your body.
Right.
But the more and more you get your body moving, if you're hyper, if you have EDS, again, light, be smart, work with a physiotherapist, work with a doctor. What I found in my research is that there are so many groups that are like EDS workout groups. I didn't even know that, Sharifa. I was like, oh, I'm so part of this.
Yeah.
Some of the other things is positional sensing. So basically, I'm going to show you a little something. So comprehensive. Yeah, that's right. Comprehensive. I'm showing you the compression stocking. Some people want to call them spankies. You girls want to call them spankies to suck them in, make yourself look good. But those compression stockings, those compression leggings, those compression suits, they help you to keep your positioning together and not making yourself as loose and mobile.
I didn't know that. Remember I said, you look cute today?
Yeah, we're putting different things in together. Never judge a book by its cover. I'm telling you guys, you did not know. I got me some, compression stuff underneath here to take care of my body. So there's also, like you were saying, treatment for pain and fatigue. And I can't wait for us to actually get into the episode of this. There's other things that are going on, but some of the coping styles, your family members, there is something called a genetic counselor, your partners, your doctors, your counselors, your physiotherapist, and your occupational therapist. Rifa, tell us, because a lot of people are here, they may have EDS, they don't know if they have it. Where are some of the specialists in the associations that they can go to?
So some of the associations would be the Atlantic EDS Society, and they're based in Halifax, Nova Scotia. There's also the EDS Charitable Foundation. Along with EDS Canada, there's Canadian Ehlers Danlos Foundation. So there's many different things or places that you can find. If you type in EDS, a lot of things pop up that you guys can find support. I know we joined group on Facebook for EDS, so that's also a thing. You get to correspond with people who directly deal with this kind of issue.
Okay. So let's get into our question of the week, Mama.
Okay, so this question of the week this week was a poll that I did. So the question was, at what age did you get diagnosed with EDS or hypermobility? And so I had put two options: 0 months to 25 years, so when you're in your younger stage, or 26 years and older. And 100% of people that answered said 26 and older. So that's very interesting. So it's kind of like you never experienced or knew what was going on until, your older age, which is now that you're trying to figure out if this is what it is. So
you don't need to bring my age into this.
I mean, I just said older. Yeah, 100% of people who answered said 26 and older. So
okay. So shall we give them a little bit of a keep it moving moment then?
Let's get into it.
Okay, this one is really clean. I love it. I've heard it before. It's by Ed Malet, and it says, "You cannot love yourself if you are not being yourself. You cannot believe in yourself if you are not being yourself." And this one's very true to our chronic pain conversation, because a lot of times we try to hide who we are, what we're dealing with, the pain that we're going through.
Yep.
So we just want to tell you, be you in the midst of it all. People will love you or leave you, but the ones that love you need to be beside you.
Yep.
Yeah?
Yep.
All right. So what do you have to say?
I find this very interesting. When I was first researching about this, I was like, oh my God, that bruise last week, could that be EDS? Or, I think about when I was younger and doing like gymnastics, I'm like, was I considered EDS? But it's just a matter of knowing your symptoms with everything we talked about. Don't be afraid to do your own research, like we always say, and ask questions. And, follow your gut. If your gut says, I need to go find out if this is what it really is, there's no harm in doing that.
There's not. And if you do the research, I'm going to jump onto that. If you do the research and you go to your doctors with, okay, this is what the diagnosis is, and these are some of the things that I feel, can we take a look into it? Don't ever think that Google is going to give you all the information.
All the answers. Exactly.
But you are allowed to make a hypothesis, put together a couple of different, factors, take it to the doctor and say, can we have a conversation? Right? If you go to them calm and with all your ideas in together, they'll be willing to sit down with you. At least most of them should be. Okay. So I guess that's it, my love. This is the end of our show for today. We went by really fast, didn't we?
It did. But I'm Sharifa McLaren Thomas from The Thomas Life on YouTube.
Yeah. And I am Kalila Bruswell, your overcomer. Thanks for joining us for another episode of Chronic Pain Conversations. We'll be back next Tuesday. I love this. Discussing love, sex, and pleasurable pain. Okay, I'm just going to move that. Do that again, Sharifa.
I'm excited. I am so excited.
She's married. She's allowed to be. I'm single.
It's legal, boo. In my world, it's legal.
Anyhow, be sure to follow us on Facebook, Twitch, YouTube, or Instagram at CP Conversations. And if you are a chronic pain sufferer who would like to share your story, we invite you to be our guest by filling out a survey on any of our bio links. So that's it, you guys. Have a blessed day. And remember, Chronic Pain Conversations is the show that enlightens and advocates about chronic pain. Have a blessed day.